Clouds on Mars Products, a place where you begin your journey with innovative, visionary, and easy to implement solutions for your business. Good morning, good afternoon, and good evening, wherever you are. This is Clouds on Mars Products. In this series, we talk about real business challenges that our customers put in front of us and the way we solve them. We will discuss a little bit of technical stuff, but we really want to focus on business impact. My name is Marcin Kubica. I'm head of product at Clouds on Mars, and I'm joined by Estera Kot, CTO of Clouds on Mars. Hello, Estera. So good to have you here.
Hey, everyone. Thanks for invitation and thanks for having me.
Today, we want to discuss the situation in the healthcare system. I did a little research and I found out that in the healthcare system, about 55 to 60%, and it's basically the same number in Poland, in Europe. I also checked the US. So between 50 and 60%, this is the cost of medical staff, basically salaries. Then we have between 15 through 30% of cost that is attributed to purchasing pharmaceuticals and medical materials. And the rest is attributed to other costs, like, for example, diagnostics, lab work, imaging, equipment, amortization, administration, IT, all other stuff. And recently we had a discussion with Estera that this is something, all three categories are the categories that can be addressed in terms of efficiency, cost effectiveness, using tools like analytics, BI, AI. All those elements combined can bring a lot of benefits for the healthcare system. And that's the topic of our today's discussion. So, Estera, let's discuss those three categories. When you think about salaries for medical staff, what are the elements that we can improve in this area? Then we will discuss other two elements, and then we will dig into our main topic today. But let's start with the medical staff.
I think that it's even broader for lots more industries, meaning that with having AI, with having a very solid IT systems that are cutting the time that we need to deliver things, to do things, the model of the world when we just focus on paying for every minute that the radiologists, oncologists spend on a specific case is going away. To give you a specific example, take a look at the normal MRI check. It's not only about, yes, as a patient, we need to have time to go through it, but as a radiologist, you need time to properly analyze it. And as of now, if you do not have any copilot, any tool that is supporting you with moving your focus towards a specific aspects, meaning that as a radiologist, you want to focus on, for example, a liver. And of course, you take a look at the entire stomach, but your primary focus is on the liver. And here, there's a beautiful opportunity for AI system that is guiding you and giving you statistics based on specific calculations where you should focus because there is something suspicious. So the time that you need as a radiologist, the time that you need to deliver such a description, such a medical results can be just shorter as you are not incentivized for every minute, but for the result, because the result can be delivered faster with AI. And you can get additional eyes of something, what is doing the reasoning, what is doing the thinking, and can give you some insights, which can basically help you to deliver more with less time.
So what you're saying is that the modern technology like AI can help technicians, can help doctor speed up the work that they do by helping them in some administrative work. So it can remove or reduce this work that they need to do in association with the core work. So analyzing patients' data and having discussion with patients. So this is one element. But there is another element that can be improved. There are for sure moments on the timeline when clinics, hospitals, they may have too much staff versus how many patients that they need to handle in a given time. So having a way to manage their staff in a smart way is another opportunity to optimize the cost of operating hospitals.
Definitely. With the new technologies, we are democratizing access to the medical forces that as a patient we would like to have. So yes, everything would help them to run smoother and to decrease the final cost of some medical examination for us, for patients.
And that's important for various reasons. The one thing that I have in mind is that the society is aging in Europe, in the US. So the need for medical personnel will be growing. So there'll be more and more demand for this kind of professionals. So naturally, the cost, since demand is raising, the cost will be raising too if the supply will not be sufficient. On the other hand, there are other factors that are increasing the cost of medical personnel. So looking for ways to make their work efficient can benefit themselves, can benefit hospitals, and maybe this is the most important element, will benefit the patients. All right, so let's discuss the second element, pharmaceuticals and medical materials. That's the second category that generates cost for hospitals. What kind of improvements may we have in this area?
I think that here the biggest is the optimization of the supply chain of the things. Because if we talk about optimizing the things, sometimes it's a room, sometimes it's a operating room, medical equipment that is needed to run the specific operation. So if you talk about things, that's how I'm calling them. Here, the concept of optimizing the delivery and making sure that the things, and here also the medications, the pills, once are there in a hospital, we have a system that prevents running out of the usage date for them. So basically do not cause waste. And with having things, sometimes it's good to have some bigger stocks because the flu season is coming. And of course, we will need more vaccinations during that time. But otherwise, also be wise in an aspect of do not reorder too much and do not also from the other side be trapped in the second cost. So basically an optimization, the wise optimization, AI supported optimizations of the workforce scheduling, of the medical equipment ordering, supply chain for them as well, cold chain for the medications, just to be sure that cold chain events that delivered glucose, for example, didn't had a case that the temperature was just too high for a specific number of minutes. But the aspect of the optimization that is also connected with the aspect of the first pillar, meaning that we have people who are operating in a specific environment. We can help those people, medical experts. Now we are helping to optimize their time, and we are helping the equipment that they need to deliver the service to be also optimized from the cost perspective, from the delivery perspective.
All right, so in this part, we have classic stock optimization, the typical element of basically any industry, but the supply chain segment of this industry. So we don't want to have excessive stock. But there is also another element, especially important in the healthcare system, the expiration date. We don't want to waste medicines, right?
Especially recent news where that every month, just measured in a few cities in Poland, we are throwing away tons of medical equipment, tons of medical medications, pills that were running out of the usage date and expiration date. And that is summarized to the enormous amount of money that we as a patients are just, throwing away. And those medications cannot be used by someone else. So maybe also taking a look from the legal perspective, just to make sure that maybe having a law that yes, we can reuse if the box is not open. But at the end, it's for the hospital, for the medical institutions, it's about the system that is preventing those cases.
Yes. All right, let's jump into the third category, which is other costs. So, of course, there's administration. We can elaborate on the administrative costs, but let's focus on the cost of equipment. So it may happen that hospital may come to the conclusion, well, we need two MRIs instead of one MRI because demand for procedures using MRI or the tests using MRI, this demand is so high that we need two machines. But in reality, it may happen that they still need one machine, but it's all about optimization of prescribing the tests and Yeah, tests. Tests? I think tests,
Yeah,
not procedures.
Yeah, I think that here intelligent scheduling and connecting the time of the patient, the time of the medical experts that are needed to run the procedure, and making sure that the optimization is wise, meaning that it's intelligent. We have some stats, we have some data that is telling us, do we for sure need the second MRI? That's a big investment. Maybe the bottleneck is not MRI, maybe the bottleneck is just a time of here radiologist that is required to deliver the detailed description. And here, maybe having just one MRI is good enough. And if we take a look at the schedule, knowing that we live in more and more fast environment, and there are people who can be willing to have the MRI during the night as well. Yeah, I would suggest taking a look that for sure if the MRI machine is used really over the 24/7, and here intelligent scheduling. And also I would connect that with the access to this MRI, meaning that democratizing access to the services that hospitals are running. What I'm meaning that every hospital is having some number of medical experts that are providing services. If we take a look from the map perspective, for sure, very closely, like a street away or a few kilometers away, there is another similar institution. And have we asked ourselves, are we partner? Meaning that, like, do you, as a big hospital, provide the ability to get the MRI scan for this small institutions, more private center, soon not far away from you? If not, think of how we can democratize the access to the equipment that we have, the medical forces that we have, and also the data in the future that you have. So it's about being connected and going and working in a partnership mode.
Very good. Thank you for your viewpoint on that. All right, so let's discuss the solution that we've been working on recently. We call it MedHub, and it solves a couple of challenges that hospitals may have. Would you be willing to walk me through the solution,
Of
Estera?
course, maybe first we'll put the demo so everyone
Sure.
can watch step by step. Super. Let me walk you through the MedHub system. So here, let's take a look at a few roles that we have and take the shoes of Tomasz, who is the hospital administrator, who is also taking the shoes of the director of the hospital just to make sure that it's running, operating. Good. Now, we are landing in a system that is democratizing access to the equipment, to the medical forces, and also to the data. And let me explain step by step. One of the primary challenges that every hospital is having, and also every enterprise customer has, is the number of different units, business units, specific units that need to be connected to the central system. So different data sources needs to be integrated in one single data platform just to start bringing and building the one source of data that we would love to have. And here we connected a few departments from cardiology, oncology, radiology, neurology, and so on, as well as emergency, to one central system, which is allowing to use AI for processing the data and is providing live insights. To be specific, because I know that this was just an introduction of how complex the medical environment in the hospital is. Here, imagine that as a patient, you do not visit just one single expert. Many times, yes, you go to cardiology, but that medical expert is telling you, yeah, you need to visit radiologists as well, and so on. So one of the huge bottleneck of any hospital IT environment is the lack of connectivity between departments that is causing a huge waste of redundant medical examinations. Here, an example that with having a system that is connected to one central lane of data, departments which are connected, we can detect automatically as part of the AI insights. We are detecting that here, very tangible, specific example, 34 of MRI scans were redundant, so duplicate tests. What caused them?
What is the cause, Estera? That's a
The
good
cause is
question.
that as a patient, you visit one expert and he's giving you a referral for a specific examination. And after doing that, this one expert is acknowledging, respecting those results. If you visit another medical expert, and let's tell the truth, many times we do not visit just one center of a family of the centers. We visit privately very different medical experts or very different, not connected with them, medical experts within a hospital. So once you visit someone else, you are asked, first of all, can you provide me the results from your past? And this new expert is taking and respecting those results, but majority of the times you get another referral. Why? Because we have to be cautious and also have a limited trust to what patients are bringing. So the result is that if we do not have a central IT system for a hospital, for medical institutions, also for the country, then a case for redundant duplicate tests is huge, because then experts do not trust what patients are bringing to them. And from the other side, as a patients, we are just blindly following the referrals, which are basically you need to repeat the specific tests very often.
So basically, in this redundant tests or procedures, there is a lot of cost hidden that can be basically saved. There is a percentage of tests that can be avoided if the information flows correctly between different specializations, between different doctors.
For sure, for sure. Here you can see that as a patient, you see 3.2 specialists with 0 shared records. Yes, and you do, and some medical examinations are dangerous for you to repeat them too often. But you repeat and have the redundant scans and medical examinations just because the system is not connected. So it's a technical, it's also adaptive problem. But here we need a system that's connecting all of them. And this is what we've built, a system that is democratizing access to the AI for medical experts, but also for patients. A system that is allowing you to have one central platform for a hospital and to be sure that we are not landing in a case of the waste caused by redundant examinations, which can be so easily avoided.
So someone might say, well, there are doctors, there are nurses, there are those who see the medical documentation of a patient, and they may say, well, these are smart people. They should be able to detect this kind of situations. And I'm sure that they are capable of detecting it. And perhaps in majority of cases, they are detecting this kind of issues. But if there is even a percentage of that, let's say 5 or 10%, that can be really avoided,
Yes.
or can be detected by the machines, by the systems, it's a tangible saving for the healthcare system.
It's a huge saving. And for sure, they are super clever. The challenge is just with the time and the attention span that we have. They are helping hundreds of patients during the week. And they just need a support with that. And here you can take a look how the tool can support the very primary investigation and make the visit for the patient much more smoother. Here, we are taking a look at some patient. We are getting AI summary. We can see recommendations that we are getting for these patients, their results, blood pressure, heart rate, and so on. And we see lab results. And what's the most important? We see the timeline.
Beautiful.
The timeline of the medical examinations, visits, all of the tests. And this is simplifying a lot just to have this level of clarity. And then as a next step, we are getting the flags that, yes, there are some duplications happening here.
This is awesome. And this is a nice step toward, let's call it patients 360 view for the medical staff, right? So they can have all the information about the patient in one place. It can be easily summarized. It can be easily displayed, very readable, easy to use. Very good. Nice.
Yes. And this is an example of the system for the hospital. And as I mentioned, every hospital is having some kind of a partnership with smaller private centers that are helping patients. And here we also designed a module that is allowing those external doctors, which are part of the hospital's network, with respect of the patient law and after the patient is agreeing to, but having access to the data. So this is a game-changing way how to basically organize and democratize access to patients' data. After and once they agree, for external doctors, for smaller institutions, just to, in this case, very particular case, Hans, even though he was in a hospital, he was having all of the examinations in one specific hospital that is having MedHub. But then he decided that he's going to visit some local doctor in a small village that he is coming from. And he didn't get all of the medical data. Again, in Switzerland, it's not the standard. That's why, because of interconnection and ability to federate those institutions, even the small village medical expert can access to Hans' results after Hans agree and get also the AI summary and key parameters.
Very good. Thank you very much for showing that. And this system can also help hospitals aggregate data from patients, right? They can be fully anonymous. So we are not keeping any personal data, right? But we have very good image of the health situation of the society, or at least the group of patients that visit a particular hospital. And this data can be very useful, right?
Of course, I think that the data safety is a technical problem. The respecting privacy of the patients is a technical problem. You tell us, the authors of those tools, that it has to be safe and data must be anonymized, and done. We are building the algorithms and making that happen. So it's not a big debate. And just to guarantee that, again, on a country level, on a hospital level, we have access to the most important statistics, but also on the country level, we have access to the most important data that are helping us to run a country. But we don't need details. We need just the stats, the trends. And if the system is expected to be secure, meaning the data is encrypted, as a patient, my data will not be revealed. Meaning that all of the informations related to my medical examinations, like MRI scans, as well as the very sensitive topic of my weight and so on. Again, this is a technical problem. We need just to put the expectations. It must be secure, no debate.
Mm-hmm.
But yes, as you mentioned, great thought in terms of the access and sharing the data. And here, by the data, I mean the high-level metadata, sometimes the fully anonymized patients' data sets, sharing them with the scientists, with pharma companies, with researchers from different universities. Because here we want to combine two words. One of the primary challenge for every IT researcher at university is access to, like, having a good use case worth of pushing, but then having the access to data. And with having a system where we are connecting the world of hospitals, having tons of data, with the world of researchers, having beautiful brains, but having zero data, but having the power to do the processing, create a new neural network that will discover brain tumors and so on. Having a system that is allowing them to work in one single place is an asset.
Mm-hmm. Very good. Estera, thank you very much. That was a very nice walkthrough. We definitely see a lot of opportunities for the healthcare system. Cutting costs is one opportunity. Generating a new stream of revenue is another interesting topic for the healthcare system. So indeed, the modern technology can offer a lot for this industry, and it's just a matter of having a good discussion with the healthcare professionals and find points or places in the process where this new technology can be introduced and tremendously improve the cost and efficiency of the system. Very good. Thank you very much. Well, that was another episode of our Clouds on Mars products. If you have a challenge, a business challenge that you would like to share with us so we can think about it, we can digest it, we can research that and come up with a solution for you and for others, please let us know. Here is the LinkedIn profile of Estera, and here is a LinkedIn profile of myself, and you can contact us And here is also the Clouds on Mars LinkedIn profile. We encourage you to follow us to hear about another updates coming from us, from our team. Let your data make an impact.
Let's make an impact.
Thank
Have a
you,
great day.
Estera. See you next time.
See you.